My guess is you have heard about Botox treatment, the top non-surgical beauty procedure in the world. Botox treatment uses Botox, a neurotoxin derived from Clostridium botulinum, to treat facial wrinkles. Botox is used to treat whole spectrum of facial wrinkles like frown lines, horizontal forehead lines, crow's feet around the eyes, bunny lines on the nose, dimpling of the chin, vertical neck bands, and smoker's lines around the mouth. Almost any wrinkles can be treated with Botox. Why choose us? Our procedures are done by the best and most qualified doctors who ensure that you get the best, most natural, and longest-lasting results. We also offer free consultation services to help you choose the best procedures for your face. Also, you get the most competitive prices and most efficient services in a friendly and relaxed environment. Our referral program is second to none, and most of our patients refer their friends and family members. So if you are looking to give your face a youthful boost it's been waiting for, call us today and don't delay your rejuvenation for another day.
Your nose will be photographed in 8 different angles, and the possible after-surgery look of your nose will be displayed to you in 3D simulation. With closed rhinoplasty technique, nasal humps can be removed, nose tip can be lifted, curvature of nose bridge can be straightened, asymmetry in the nostrils can be fixed. Right along with those, if you have concha or deviation problems, they can be treated in the same session. Closed rhinoplasty technique won't leave any visible scars on the tip of the nose. Structure of nose contains nasal bone, upper alar cartilage, lower alar cartilage, and in the middle line, nasal septum. Under general anesthesia, with intranasal chisels, upper and lower alar cartilages will be relocated in the middle part. Nasal hump will be removed without hammer by using special equipment. Following this process, nasal bridge will be rasped. After the hump is removed from the nasal bridge, right and left side of the septum will be cut vertically, and then double-sided horizontal cuts will be done at the top of the nasal bone. For achieving an aesthetic side view of the nose, upper side of the lower alar wings will be removed. After this step, cartilage grafts taken from the septum will be relocated either side of the upper septum. The vertical cartilage graft, which will be placed in the nose tip, and lower alar cartilages are shaped with stitches, thus looseness of nose tip and asymmetries of the nostrils are fixed. Cuts on the nose tip will be closed by the anatomically dissolvable stitches, therefore there will be no need for removing stitches. For the final touch of the aesthetic form, lower sides of the nasal bone will be cut downwards. Later, the gap in the nasal bridge will be closed by pushing both sides. For supporting the internal structure on the middle line, silicone leaflets will be placed in both nostrils. After the skin-colored special nasal strips are applied, operation will be finalized with placing thermoplastic splint on the nasal bridge. Now, if you wish, we'll show you before and after images. Nasal hump is removed. Nose tip looseness is fixed. Curvature of the nasal bridge is centralized. Asymmetry of the nostrils are fixed.
The presynaptic neuromuscular nerve ending contains membranous vesicles prepared to release its stored neurotransmitter, acetylcholine. Neuronal stimulation initiates a cascade of events that leads to the fusion of the neurotransmitter-containing vesicle with a nerve membrane. This process is facilitated by a group of proteins comprising the snare complex. The membrane fusion results in the release of acetylcholine into the synaptic cleft by a process of exocytosis. The acetylcholine diffuses and eventually binds to receptors on the muscle, leading to muscle contraction. Botox, botulinum toxin type A, consists of a heavy chain of 100 kilodalton and a light chain of 50 kilodalton, making up the 150 kilodalton core type A molecule. The toxin is protected by accessory hemagglutinin and non-toxic non-hemagglutinin proteins, yielding a uniform 900 kilodalton complex. This illustration shows a cross-section of the spine, with a motor neuron extending into the muscle and a sensory neuron extending out of the muscle. After injection of Botox, it would be expected that most of the neurotoxin would remain at the injection site. The Botox core molecule dissociates from the accessory proteins and targets the nerve endings. The binding domain of the Botox core molecule is the C-terminal portion of the heavy chain, with an acceptor on the nerve. The Botox core molecule enters the nerve cell by a process of receptor-mediated endocytosis. It is the heavy chain that contains the binding domain. The toxin is now contained in a membranous vesicle inside the cell. Soon after, the light chain is released into the cytoplasm of the nerve terminal, where it begins to cleave one of the snare proteins. In motor neurons, the light chain of the Botox core molecule blocks the release of acetylcholine by cleaving SNAP25, which is an essential component of the snare complex. When acetylcholine cannot be released, muscle contraction cannot occur. In sensory neurons, the light chain is believed to cleave SNAP25 by a similar mechanism, thereby blocking the release of neuropeptide neurotransmitters and inhibiting the sensitization of pain nerves. The toxin does not appear to affect the conduction of electrical signals along the nerve fiber or the synthesis or storage of acetylcholine.
Инъекции ботулотоксина типа А являются распространенной и популярной косметической процедурой, применяемой для разглаживания нежелательных складок и морщин на лице. В основе препарата лежит токсин, вырабатываемый бактерией ботулизма, однако в малых дозах он безопасен. Инъекции ботулотоксина помогают разгладить морщины и складки, вызванные работой мимических мышц лица, что наиболее эффективно вокруг глаз, на лбу и в районе переносицы. Перед процедурой врач обрабатывает кожу антисептиком. Инъекции почти безболезненны, поэтому местная анестезия применяется редко. Ботулотоксин вводится тонкой иглой в заранее выбранные мышцы лица. Процедура длится не более 10 минут. Ботулотоксин блокирует прохождение нервных импульсов к мимическим мышцам, в результате чего они теряют способность совершать движения. Морщины разглаживаются, и проблемные зоны выглядят более гладко. Сразу после процедуры на лице могут появиться небольшая припухлость, краснота, синяки или онемение. Но эти симптомы в большинстве своем незначительны и исчезают в первые дни после инъекции. Эффект от введения препарата полностью проявляется в течение 3-7 дней после процедуры. В этот период не рекомендуется употреблять алкоголь. Эффект от введения ботулотоксина продолжается в среднем 4 месяца. После этого деятельность мимических мышц полностью восстанавливается.
Introducing the DermaPen, a fractional microneedling device that works to tighten, lift, and rejuvenate the skin. DermaPen is effective in reducing fine lines and wrinkles, minimizing pores, stretch marks, keloid, surgical, and acne scars. This animation will demonstrate how DermaPen treatment can provide drastic results for improving the appearance of acne scars. The unique spring-loaded needle tip uses an automated vibrating stamp-like motion that enhances results while offering a more controlled and safer method of treatment than other microneedling devices. DermaPen's patent-pending disposable microneedling tip comes in sterilized individual packages that are easily replaced and loaded into the spring automated device. The DermaPen tip has 11 stainless steel microneedles, which can be adjusted from 0.25 to 2.5 millimeters, giving practitioners an innovative skin therapy system that is designed to cater to individual patient needs. DermaPen's needle depth can be adjusted during the course of the procedure to accommodate different treatment areas, and can easily maneuver around facial contours and delicate features, such as the eyes, nose, and mouth. For the treatment of acne scars, a needle depth of 2.0 to 2.5 millimeters is recommended. Damage to the elastic support structure beneath the skin surface is what causes acne scars. Your skin is comprised of two layers. The epidermis is the outer protective layer from which skin cells generate and are shed as they move to the surface, and the underlying layer is known as the dermis. The dermis is comprised of a loosely organized mesh-like network of collagen and elastin fibers that provide your skin with structure, support, and elasticity. Scars are created in response to skin damage. Cells called fibroblasts enter the site that was damaged by acne and create new collagen. However, instead of regenerating a mesh-like network of collagen and elastin fibers in the same manner that existed before, the new collagen is produced in a fashion where collagen fibrils are linked in a single direction, resulting in fibrous tissue that lacks the smooth, elastic properties of normal skin. This scarring process can result in pits and depressions, ridges, or thickenings. The following are the most common acne scars. Ice pick scars are the most common acne scars and appear as deep, narrow pits. Boxcar, depressed fibrotic scars are the second most common type of acne scars, typically occurring on the cheeks and temple regions, and appearing as deep or shallow depressions with steep edges that resemble chickenpox scars. Rolling scars are less common and appear as broad, shallow, wave-like ridges that result from excessive collagen production beneath the surface of the skin. Most people have a combination of acne scar types, and DermaPen treatment can improve the appearance of each. The DermaPen microneedles that penetrate the skin puncture some of the cells but do not damage the entire region. Damage from the micro-injuries allows small amounts of cellular material to leak out and an influx of ions that disrupt the normal state of the cell. Rather than rapid catastrophic cell death that results in an extensive immune response, the DermaPen-treated cells begin a process of programmed cell death where the cell starts to shrink, lose its attachments, and breaks into small compartmentalized units. The result is a minimal immune response. Immune cells that clean up the cell debris are attracted, and released cellular signals draw a better blood supply to the region. DermaPen treatment locally increases levels of transforming growth factor beta-3, TGF-beta-3, which plays an important role in scar-free wound healing. Fibroblasts are attracted and begin new collagen production, while skin cells that will heal the damaged surface are mobilized. The minimal immune response and presence of TGF-beta-3 allows new collagen produced to be oriented in a more mesh-like basket weave pattern than the previous scar tissue. The new tissue fills the micro-injury sites, sealing and binding the region together with collagen, having elastic properties similar to the original skin, which drastically reduces the appearance of acne scars. DermaPen treatment also has an advantage of being less likely than related treatments to result in a side effect known as post-inflammatory hyperpigmentation. This condition results from the stimulation of skin pigmenting cells that occurs with more extensive immune responses. The result is often discoloration of the treated scar areas, particularly in people with darker skin types. DermaPen is reported to have the lowest risk of this side effect compared to other conventional treatments, including chemical peels, dermabrasion, and laser resurfacing. The result is greatly improved skin tone and texture for all skin types, textures, and pigments. The stamping action of DermaPen's vertical needles occurs at a frequency of 90 Hz, which is optimal for blocking pain, similar to a TENS device used in physical therapy. Therefore, Dermapen is not only effective in minimizing pain and bleeding, but also offers a safe, consistent treatment method that rejuvenates the skin. Dermapen offers exceptional results, is cost-effective, easy to use, and has the precision and control of more expensive treatments. This groundbreaking technology, combined with low-cost disposable tips, makes Dermapen a revolutionary breakthrough for beautiful skin.
To begin, anchor lines are drawn and incisions are made along the markings on the breasts. The skin between the anchor incisions is then excised. The new skin edges are brought together and the hidden nipple areola complex is then pulled through the skin edges and placed into its new position. Once the surgeon is pleased with the position and shape of the new breasts, the open skin edges are closed with sutures. This style lift works mainly on the bottom portion of the breast. Thus, if a more youthful and rounded appearance is desired, breast implants are typically inserted during surgery to create fullness in the upper portion of the breasts. After completion of this lift, the breast skin remains as the support structure for the weight of the breasts, and stress in the neck, shoulder, and back can remain. The procedure begins with an incision around the areola. This is followed by a transverse cut above the areola and then along the inframammary fold. Lastly, an incision is made where the new nipple areola complex will be situated. The skin is excised, and then using the patient's own breast tissue, new breast mounds are created and elevated high up on the chest wall. The new breast mounds are then secured permanently to the pectoral muscles. The skin is then pulled down over the new breast structure, and absorbable sutures are placed at the new nipple areola junction and the inframammary fold. The design of this suture pattern hides the scars around the areola and in the shadow of the breast. With the lift completed, the weight of the breasts have been successfully transferred to the chest wall rather than the skin envelope used in traditional procedures. This approach provides immediate relief from back, neck, and shoulder pain.
Remove makeup and use face wash to clean. Massage around cheek, nose area, and forehead. Dab cotton in toner and wipe the whole face with it. Soak thin layers of makeup cotton in black hat expert liquids and apply them evenly on enlarged pores. While waiting for black hats to surface, use hydrofacial handle on forehead, nose rings, mouth corner, and cheeks to clean out dirt and gunks. Wipe face clean with a fresh towel or tissues. Spray the whole face and make sure it's moist enough for the cleaning scrubber to take effect. Press gently on the skin and slide upwards vertically on forehead. along the cheeks in lines as well. Wipe face clean again with a fresh towel or tissue. Plug in the device and connect the wires. Install the master gun and place it properly. Turn on the device. Choose language, swipe the ID card, and install the head of the probe. Bottle the glass with essence and install the glass on the handle. Adjust technical parameters including EMS and RF energy level. Click on the button to start. Brace the skin from jaw and extend to the whole face. Slide the probe along the facing lines and generally upwards. From jaw to earlobe, from nose wing to the middle of the ear. Try your best to make one line right next to another one so that you can make sure you've covered the whole face. During the process, make sure there's no air between the head of the probe and the skin. Brace the skin in the direction of jaw, cheek, eye, forehead, and nose. With the other free hand lifting to make the treatment surface tight and easier to slide down. Double the operation on where skin is especially dry. You might hear slight noise coming from the head of the probe, which is normal. Start from one side of the cheek and finish with the other one. Careful with the eye area because they're really sensitive. Gently move the probe upwards on forehead. Wipe face clean and apply hydrating mask for around 15 minutes afterwards. Take off the mask and wash or wipe face clean. Carry on with the regular skincare routine. Apply toner, essence, emulsion, cream, and sunscreen. Fully massage the face until they are absorbed into the skin.
Using the most advanced technology for skin analysis, VisiaScan machines measure fine lines and wrinkles, texture, sun damage, even pore size. With this technology, the scans also monitor the changes to the skin over a period of time and can reveal a person's true skin age. Simone received her results after the 30-day trial.
So Simone, let's analyse your results. We have here your wrinkle score. Looking at your before and afters, you can see there's a significant change and reduction in the wrinkles, especially around the eye area.
That's amazing.
And now to your pores, and again a fantastic result.
Look at my nose, look at the ones on my nose.
Taking a look at the results on the texture of your skin, you can see the obvious improvement.
Oh wow, yeah.
Now when you started, we had your skin at 53 years of age, and look, you've dropped down to 50. That's 3 years off the appearance of your skin in just 30 days.
I can't believe that. 30 days of using the Microderm MD, that's just amazing. I'm so impressed.